Welcome. I'm going to take us through 5 examinations for ankle evaluation. Our first test, called the Thompson test, is going to evaluate Achilles tendon ruptures. You have your athlete or patient lie on their stomach, grasping the calf and lower leg firmly in your hand. You're going to squeeze. While doing so, you're going to watch for movement at the toes. If there's been a rupture to the Achilles tendon, the toes will not flex. Now it's important when doing all tests that you make sure and test bilaterally. So we'll go ahead and assume the position, squeezing position over the calf, and squeeze. And that's what we're looking for. Our next test will evaluate the anterior talofibular ligament of an athlete's ankle of suspected injury. Having the client sitting upright on the table, ankle hanging over, completely relaxed throughout the leg. You're going to start away from the injury and come towards it, palpating the injury. What we're looking for is the anterior talofibular ligament, which is running right about in this area, generally right in here. To perform this test, grabbing the relaxed ankle from the athlete, you're going to cup the heel with your fingers, supporting the base of the foot with your forearm. Next thing you're going to do for the anterior drawer test is you're going to, holding the anti-crux in place at the distal end, you're going to try and slide the foot forward towards the practitioner, testing the anterior talofibular ligament. Bringing the foot into a gentle, neutral position with possible slight plantar flexion, sliding the foot forward. Now, as with all good practitioners, you should always check bilaterally for movement. What we're looking for here is for this foot again to slide forward, perhaps more than the other, testing this ligament right here, anterior talofib. The next test we're going to perform in an ankle evaluation will be testing the lateral, from the lateral malleolus down to the calcaneotalofibular ligament. This one again also prevents ankle inversion and is one of the second most commonly sprained ankle ligament. To perform this ankle inversion test that will stress the lateral CNF ligament here on the ankle, again, you place your hand underneath the ankle, adding support. You place your thumb here as well to try and feel any gapping that might occur, and also feel any any looking for ecchymosis and trying to feel for any crepitus or perhaps injury. See if you can pinpoint any pain for the athlete. What you're going to do is bring the ankle into the neutral position, grasping, keeping that thumb here and wrapping your hands around the other side. You're going to invert the ankle, stretching this ligament on the side here, looking for gapping. And again, to be completely sure and to get a better assessment, you're going to also perform the test on the bilateral side. So again, feeling for any movement and gapping in that, and also reading the athlete's reaction. A similar test that will now test the deltoid ligaments on the inner side of the ankle here by the medial malleolus on the medial side. What we're going to do is there's a series of 3 ligaments that make a fanning position across. These are the deltoid ligaments. They're the least strained, but also worth an assessment. To do this, you can do the opposite of the test we just saw, which is an inversion test to stress the CNF on the outside. Now we're going to take the foot in the same position, feeling with the fingertips on this side, or perhaps if you prefer, putting your thumb over those deltoid band ligaments. And you're going to gently bring the foot, keeping it relaxed, keeping the athlete relaxed, into a neutral position. And then you're going to evert the foot. By everting the foot, you're looking and feeling for gapping and any point tenderness on the inside, the medial side here, where those deltoid ligaments occur. Another test when doing an ankle evaluation will also be to test the anterior deltoid ligament right in here. To do this, we do what's called the Kliger test, bringing the foot into a neutral or slightly plantar flex position, again supporting with the heel with the palm of the hand, wrapping and cupping, supporting the toes and the foot along the arm. You're going to bring the foot into the position, and then you're going to evert and externally rotate the foot, emphasizing on the external rotation to open up and stress this anterior deltoid ligament of the ankle. You will test this bilaterally as well, to get a read. See if you feel any gapping, see if there's any more play or range of motion on one side to indicate a possible tear to that ligament. To also test for a high ankle fracture or high boot sprain, sometimes called, you do a syndesmotic test where you're testing where the fibula and the tibia come together, that syndesmotic tissue joining the two. Same as the Kliger test, you have the foot supported with your hand underneath. Bring the foot into a slightly dorsiflexed position, that is bringing the foot past the neutral position into dorsiflexion. You're going to again evert and externally rotate with emphasis on the external rotation of the ankle, such as this. You're looking for that pain coming in here. If you have an occurrence of pain that's coming through the upper fibula or possible strumming through here, to be sure, another test you can do is called the Potts compression test. A positive sign would be pain, tenderness in here. What you want to do is called the Potts compression test, where you actually come proximal to that injury and wrapping your hands around both sides, interlacing your fingers. What you would do is you would squeeze in, pushing that fibula against the tibia, causing that fibula to move. Now when you do this test and you're squeezing, if that pain is referred to that lower injury spot, chances are you quite possibly could have a fracture, in which case you would want to refer out for x-ray or possible MRI as soon as possible. And again, to perform this test, interlacing fingers and squeezing, pushing that fibula against the tibia.